Aloha kakahiaka, and good morning, everyone. Mahalo, and thank you for being here for AlohaCare's new internal webinar series, Enlivening a Culture of Health. We're going to start in a couple of minutes, and as we welcome our teammates, they're logging in. Please familiarize yourself with the Zoom webinar features, which are a bit different than the Zoom meeting platform we usually use. We will have a presentation, so if you can view your screen, our guests will be sharing important information for you visually. This opening slide has 5 takeaways for you to look at. Since we're not able to be able to have these conversations together, we've tried to make this as interactive as possible. So I especially want you to take notice of the chat box. It looks like a talk bubble. In the chat box, you will be able to see lots of resource links that we'll be sharing throughout the webinar. Take a look at the Q&A box. There you can ask questions anonymously, and we'll be pulling from those questions later for our panelists. And this is easier for us to see rather than inserting the questions into the chat feature. And a final couple of notes, as you can see, we should be turning on the closed captioning feature here. For the recording. The closed captioning is imperfect, as is all technology. So sometimes it doesn't get the words or terms correctly, but we're committed to supporting our participants with disabilities, and we can all be more inclusive. And lastly, we are recording this session for staff who are unable to be with us live, or if any of you want to rewatch this. So Clayton is here. He is recording the screen and our audio, but we are not recording any of you or the chat box. I'll ask Thaddeus to go to the next slide for us. Thank you so much. With those brief tips to orient you, let me warmly welcome everyone to the first episode of the Enlivening a Culture of Health webinar series. This is our first episode, and we're going to be focused on the health of sexual and gender minorities. So now is the time for us to understand the social determinants of health needs of our members and outline a strategy to address those opportunities across all of the work that we do. AlohaCare is actively monitoring diversity categories and distinct cultural groups that intersect with these social determinants of health and better tailor our approach and understanding. So for those of you who took the survey recently, this is an extension of that work that we are planning for the next few months, and these webinars are intended to be a safe, anti-racist virtual space led by the values of Hawaii. While questions and comments and examples are always encouraged, any form of racism and discrimination will encounter zero tolerance. I'd like to open and dedicate today's webinar with the intentions to uplift, support, and work towards improved health and well-being for Asian, Pacific, and Polynesian peoples who have been traditionally inclusive of third, trans, and non-binary genders. You may know them in your own cultures and your own languages as Mahu in Hawaii, Fa'afafine in Samoa, Fakaleiti in Tonga, Pinapina Aine in Tuvalu, Rai Rai in Tahiti, Muche in Japan, Nakada in Burma, and Hydra in India. If we can go to the next slide, Thaddeus, I wanted to start off with our first interactive poll. You're going to see the poll pop up on your screen. Simply answer the question response that best suits where you're at, and then you just hit submit. As you are responding to the poll, I wanted to also take this time to introduce our esteemed guests who are the co-chairs of the Hawaiʻi Department of Health Sexual and Gender Minority Working Group, which AlohaCare is a proud new member of. Jen Jenkins and Thaddeus Pham are incredible leaders, and Hawaii is a healthier place because of their commitment to inclusive research, policy, and community programming. I'm very thrilled and happy and constantly gracious to always work with them Jen Jenkins is an attorney and public policy advocate at the Office of Hawaiian Affairs. They were the lead advocate on Act 148, which adds a gender-neutral X marker on our driver's licenses and IDs and provides for self-attestation of gender, meaning an individual can self-select how they wish their gender to be recorded on their ID or driver's license without further documentation or documentation from healthcare providers. Jen believes that policies should reflect people and applies that ethic in all of their work. Thaddeus Pham is currently the Viral Hepatitis Prevention Coordinator for the Department of Health in the Harm Reduction Services branch. He is co-founder and co-director of the Hep Free Hawaii Coalition, a community-based program focused on increasing awareness and access to hepatitis services in Hawaii. In 2018, he was recognized by the National Minority Equality Forum as a 40 under 40 leader in minority health. He's currently a Bloomberg Fellow at Johns Hopkins School of Public Health. Thaddeus approaches public health from a social justice perspective and seeks to leverage community partnerships and systems-level policy change to address health disparities, regardless of disease state. For those of you who may not have met or worked with me yet, my name is Aloha Fox, and I will be helping to lead this series and moderating today's panel with our guests. And with that, I'm going to let Thaddeus lead us off.
So hi everyone, and thanks so much for the warm introduction, Aloha. I know speaking for both Jen and I, we're really excited to be here. So I'm just gonna, what's gonna happen today is I'm gonna show you some of our local data to see what's happening, especially among our youth in Hawaii. And then Jen's gonna show how that data was used to affect local change and how we can support you folks at AlohaCare to integrate what we've learned and also to see how we can support you folks. So today we're going to talk about sexual minority and transgender gender nonconforming youth in Hawaii, or what we say is sexual and gender minority, or SGM. But I just wanted to show you this so you can kind of know what acronyms are showing up once we go through the slides. And today Jen and I are the co-chairs of the Hawaiʻi Department of Health's Sexual and Gender Minority Work Group, and we're, like I said, really excited to be here. So I want to start with this because we're going to go over some of the data from our 2 landmark reports that were put out by the Department of Health in the past few years. And it was landmark not only for us in Hawaii for having the first ever health data for sexual and gender minorities, but also nationally. And so we're asked to speak at many national conferences and also by the CDC because they recognize that this is a great practice for other states to do in order to show what's happening in their local communities. And so I always start with this in a sense because we're opening the space as we enter these reports. And this is from the last report that focused more on transgender youth in Hawaii. And I'm not going to read this, but I really just want to show that these reports are not just data, but really reflect the values and the needs of the communities that we work with. There was lots of back and forth when we developed the report, not only to share the data, but in how it should be presented, how it should be used, and how it should be visualized. So I open it with this dedication that we made for our local communities, for those who unfortunately passed too early because of health-related stigma and discrimination, but also to acknowledge the resiliency of our communities and the strengths that we can draw upon to show that there is that other side of health, that resiliency. These are just the covers of the 2 reports and some of the acknowledgements. That was the 2017 report. This is the more recent one that focused on transgender youth and also include data on LGBT youth. And I just wanted to highlight here that there's way more people involved in the second one. And again, as we develop more reports and do more and more voices come to the table, or hopefully we're bringing the table to the voices. So just wanted to highlight that. So what we'll do today is sexual and gender minority youth in particular, but there was data on adults too in the report, so you can look at that. The main thing I would highlight here is just that thing on the right in the purple circle. For those of you who can see color, it pretty much addresses the theme of the data we'll see today, which is that minority stress is really the issue. So these youth are not unhealthy or at risk just by virtue of being a sexual gender minority, but it's the discrimination or the stigma that they face as a result of that leads to health issues. So I just wanted to kind of make sure that the risk is not the identity, but the risk is the the reaction to that identity or what they experience. So that you'll see throughout the data. We pulled this data from the User Behavior Survey. So this is a survey that's done in our local high schools and middle schools every odd year. It's done nationally as well. And so we didn't conduct a special survey. What we did is we pulled out the data for sexual and gender minorities and looked along the 6 kind of buckets, which I'll go over. These are just the definitions for you that since we didn't create the survey, this is how we identified sexual and gender minorities. And these are the years that we pulled them for these reports. I'm just gonna do a quick definition thing for you folks. I'm gonna keep the slide up, but this is an activity that we do in the community that I was taught and I think is very helpful. So even though I can't see you, we're gonna do it very quickly together. So if you are sitting at your desk or watching computer, if you take your right hand and put it on your head, right? And then take your left hand and put it on your lap. And that's what I'm doing right now. So you can see that your hands are very far away from each other. So when we think about gender identity, if we think about the hand on our head, that's who we identify as, which is very far and very different from our lap, which is where closer to our sex parts or what the sex organs we're born with, right? Or our chromosomes or our hormones. So gender identity and sex assigned at birth are very different, but usually they're conflated. So kind of want to highlight that. Now, if you take your hand and put it on your heart, that's an easy way of remembering sexual orientation, right? Who do we love or who are we attracted to? And again, that hand is very different from the hand on your head or the hand on your lap. So just wanted to use that exercise that we've used in the community to highlight the differences between these. And even though it's usually put together, they're very different. So transgender in this definition is when the hand on the head and the hand on the lap is different. And then cisgender is when they are more aligned, or, you know, like if you're born with as sex assigned as male and you identify as male gender. Okay, so I'm gonna just move forward with that. So LGBTQ youth in Hawaii. So what we looked at first was transgender youth in Hawaii. And you can see here that it's a fairly diverse community of students. There's about 1,200 high school youths who identified as transgender when we were looking at it. And that's about, if you add up Lanai High School and Molokai High School. So it's really, we can't ignore 2 high schools in the entire state, right? So it's a really important community of students to focus on. And already you could see some disparities if you look on the top left, that 1 out of 2 of those trans youth are unstably housed compared to 94% of cisgender youth, right? So anecdotally, we hear this is related to getting kicked out of the home or not feeling safe at the home, so that they end up sleeping on their friend's couch, or they might even end up homeless. These will appear throughout, and again, we'll send these to you folks. I'm not gonna go over each slide for very long, but this just shows the disparity between transgender and cisgender youth. And then we look separately at LGB youth, or lesbian, gay, bisexual, and their heterosexual counterparts. And again, all this is local data. But regardless, either way, our transgender and LGB youth are much more likely to have unstable housing than their counterparts. So the first bucket I mentioned is healthcare access. And this is, I'm sure, very important to you folks at AlohaCare. So basically, are the youth seeking healthcare services? Do they go to their doctors? Do they go to their dentists? And you could see here, the darker bars, so the ones towards the right and the middle, are questioning an LGB. And they're less likely to go to the doctor, to go to the dentist, but looks like a little more likely to get an HIV test. When we look at our trans youth, which is the dark purple, or the lower bars, for those of you who can't see color, they're much less likely to seek healthcare as well. And this ties into something important, which is that they don't feel safe in these settings. Usually providers, according to what we hear, might not know how to work with these youth or with these communities in a way that makes them feel safe and honored. When we think about that, if they're not accessing health, they're not getting a lot of the education and support around general health. And this speaks to active lifestyles, eating fruits and vegetables, things like that. So you can see here that our LGBTQ, and Q in this sense is questioning from the survey that we looked at, are much less likely to be active or to meet national guidelines for physical activities. And as you all know, this ties in with obesity and chronic disease. For our trans youth, they're also less likely to meet these metrics of activity and nutrition. Something that I will note here on this slide is the bottom right. Transgender youth are 3 times more likely to go hungry in Hawaii compared to cisgender youth. And again, that ties in with that disparity we're already seeing, where if they're not housed stably or if they're not feeling safe, then they're also less likely to have food security. That similar slide that I showed you, except this time we're looking at physical activity. Okay, so they're not getting a lot of support around health, and unfortunately, they're also experiencing outright violence. So for our LGBT youth in Hawaii, they're more likely to be bullied and to feel unsafe on school campus. But they're also electronically bullied. So even when they leave campus, there is a lot for them to deal with. For our trans youth, about 4 out of 10 experience some sort of bullying, either at school or electronically. And unfortunately, there's just direct violence against our kids who identify as LGBTQ. You can see it's 2 or 3 times higher for dating violence and also for sexual assault. I will pause here just to note that I know sometimes this data can be very triggering, so please take a moment if you need to step away. I presented this many times and sometimes we do have to take a breath. For our trans youth, narrative does not get better. So our trans youth, 1 out of 4 or a quarter of them have experienced sexual assault. And 1 out of 4 just stop going to school because they don't feel safe anymore. And I think, again, this speaks to creating spaces in the healthcare setting too, where these youth can feel safe and get care. This is that slide again when we look at these other metrics I already mentioned. So as they're not getting access to care, as they're not getting supportive services and being in supportive environments, and as they're experiencing outright assault in some cases, their mental health, of course, goes down. And the way most of us cope, I think, or many of us cope with mental health or mental anguish is through substance use or physical cutting or other kind of ways of coping. So suicidality, depression is higher among our LGBT youth in Hawaii. You could see here some of the data. You can see about 1 out of 2 have purposely hurt themselves already. And again, this is before they've graduated high school. For our trans youth, half have attempted suicide in the past year. So there's a lot of work to be done around mental health and behavioral health for our students. And if you can imagine the continuum of health over the lifetime, these are things that will have implications for adults as well. So we do have data on adults, as I mentioned in the report. And so this is just an important opportunity to really start prevention for our youth so that they don't have to deal with the long-term effects and sequelae as adults. This is just showing again that the data around attempted suicide among our youth, and it's horrifying and startling, but unfortunately when we talk with our community members, it's not that surprising that it's much higher among our transgender and LGBT youth compared to their cisgender or heterosexual counterparts. So behavioral risk factors, and in this kind of bucket, or what we call it, this deals with a lot of the mechanisms that folks have to deal with this mental health or this mental anguish that they might be experiencing. So for our LGBT youth, they're much more likely to not only drink currently, but also binge drink. And you could see the definition of binge drink right there on the right. For our for LGBTQ youth, that also means increased substance use. So not only marijuana, but you can see in the middle there, they're more likely to have ever injected an illegal drug. And if we think about the current opioid epidemic and issues around that, that last little infographic on the right shows that they also increase risk of taking prescription drugs without a doctor's prescription. So much more likely to experience all the outcomes that come with use of any of those drugs. For our trans youth, alcohol use is much higher. And again, if we think about coping in unsafe settings. This is something that's very common. Smoking goes up as well. And then those same three metrics, so marijuana, illicit drugs that are injected, and then prescription drugs without a prescription. This slide again compares transgender and cisgender youth and LGB and heterosexual youth. If you look at the ever injected illegal drugs infographic, you can see there that transgender youth in Hawaii are 21 times more likely than their cisgender counterparts to have ever injected an illegal drug. And I'm just going to share a moment right here when I presented this, because we worked very closely with our native Hawaiian transgender and gender nonconforming hui before putting out this report. And so when we were sharing this data back to those folks, one of the women who grew up in Hawaii, local, who's part of this hui, she started to cry, and we had to stop the presentation. And when she was ready, she told me, you know, Thaddeus, that number is so startling to me because I know exactly why. She knew when she was growing up in the 80s in, you know, a local high school here, she remembered injecting heroin because the only way she could make it through high school. And so it was so startling for her to still see these numbers so high, but to understand what her sisters were going through, her sisters and her brothers and others. So just wanted to again reiterate that this data is data, but it also has, it reflects the community experiences and what they've been through locally. So I mentioned resiliency at the beginning, and I think this is an important component of what we talk about, because I know this data can be very stark, but also we want to highlight opportunities. So the sixth bucket in this survey looks at academic achievement because it is a school-based survey. And the good news is that for our LGBTQ youth, even though it looks like there's some lower variations, generally they do just as well as their heterosexual counterparts in school, and they are just as likely to complete a post-high school program. So, so that's really good news, right? For our trans youth, unfortunately, they are experiencing, because as I mentioned before, they're not as safe at school, they don't feel as supported, or they might be unstably housed and many other factors. They're not doing as well in school. And then 1/3 of them feel that they'll complete a post-high school program. And so this question is important, I think, when we discuss it, because it really reflects the idea of looking in the future, right? Can you see something past high school, or are you just surviving right now? So 1 out of 3 trans youth in Hawaii can see past high school. They can see opportunities past. And this is not just college, but it could be vocational school or something else. But that means 2 out of 3 still need support to get out of survival mode and to, you know, move on and look to the future. So I think there's a lot of opportunities as healthcare providers, as people in our communities, to support these kids so that we can maintain their health throughout the life course. Again, this is just looking at that question about the future. You can see our LGB youth on the right, compared to heterosexual youth, do equally as well. They can see the future. But for our trans kids, they are 2 times less likely to be able to kind of see that future opportunity. So these are just some of the protective factors, again, to talk about resiliency. So this shows that heterosexual youth generally have more adults they feel like they can talk to inside and outside of school. And that about half of trans youth have an adult inside or outside of school that they can feel they can talk to. And when I talked to one of our allies, in that hui I mentioned from Kauai, she told me when we talked about this, she said, Thaddeus, you know, if I just saw someone who was transgender at school, even if they were just like, you know, mopping the floor or whatever, she said, that would have made such a huge difference to know that there's life beyond high school. So even just presence or just having someone that that kids can identify with around would make a difference. And then finally, as I mentioned, this data is just data, and we did a lot of back and forth with our local communities. So the hui I mentioned is called Ka'ahamahu, and they're powerful local advocates Native Hawaiian, trans, and gender nonconforming, and mahu wahine, mahu kane. And they were saying, you know, this data is great, Thaddeus, but what about our local ways of sharing data? Like, this survey was very colonial or Western. So how do we incorporate more talk story into this report? And so what we did is we highlighted 4 stories of local people. And so if we go counterclockwise, that's Chris, Bianca, Kaleo, and Sina. And they shared their story and grounded this data in real lived experience. So just wanted to honor them and highlight them because they're also part of the report, and you could read more about their stories in the report. And then finally, you know, there's a lot of things that we still need to do, and these are just some of them. But I'm actually going to turn it over to Jen now, because Jen's going to talk about how this data and how this all these great stories were used to drive local policy change. So thanks, everyone.
Thank you, Thaddeus, and thank you to AlohaCare and Kealoha for having us. If you go to the next slide, I can talk a little bit about Hawaii law. And Thaddeus made some really great points, especially about it's not just data; it's really about people. And so this isn't just law. This is about real people and how this will impact them. So just as like a broad general overview, the first law is our anti-discrimination law in public accommodations. And Hawaii defines gender identity or expression as the way someone expresses themselves, the way they're regarded, their appearance, and that's traditionally associated with the person's sex assigned at birth, and sometimes that can differ. And Thaddeus mentioned the X marker bill that I worked on while I was in law school. This was in the 2019 legislative session. And we were fortunate that the Transgender Youth report had just come out the year before. And so we were able to use that report and that data to talk with legislators and really bring it to life about the importance of recognizing that, especially here in Hawaii, that male and female alone on a driver's license or state document might not be enough. And when we said that, we were able to show with that data that this is what's happening to our youth. This is what's happening to high school students locally. And it's, like Thaddeus said, it's a result of discrimination, not because of being a sexual or gender minority. It's a discrimination as a result of that identity. So instead of just now, the law is in effect since July of this year, and on our IDs and driver's licenses, you can get a 3rd gender marker. And the X isn't meant to be just a singular identity. Kealoha mentioned all of the different identities that exist throughout the Pacific. And there's more, and it evolves and it changes, but we wanted to make sure that the state recognized us as people who exist outside of the traditional Western notion of male and female, and the data in the 2018 report really backed us up a lot and allowed us to have youth there and to talk about and testify on their identities or their family members. We had teachers, local teachers involved, who talked about the impact the X marker would have on their students who are first going to get their driver's licenses. It was actually a really amazing experience, and we were so fortunate to have that data from the SGM report, because I don't know if we could have made as much of an impact without it. And so that's a law that exists right now. If you want to show up in solidarity, or if you can get an X marker yourself, or if you identify outside of the binary, it's there for you too. And then the final law that I have on this slide is just the prohibition for insurance providers and benefits plans that discrimination isn't allowed based on gender identity. And that's a really important law that we have in the state, because federal laws can sometimes change with different administrations. So we're pretty well protected as far as discrimination goes, but it can always improve and get better. Laws are really great. They hold us accountable. They let us know what we can and can't do, but we don't always need the law to make a change. We can change policies internally. And so this is one of the ways that we can do that. It's through our forms. So when you're asking your patients about their gender, many forms only offer two options, and that's the binary or male and female. But there are a lot of people who identify outside of that, or it's not comfortable for them to say, I'm just male, I'm just female, or they may identify completely out of that culturally. So people who identify as transgender, genderqueer, gender variant, etc., they'll find that it won't apply to them. So the recommendation for that is on forms for service providers is a two-part question to gather accurate information about a person's gender or gender identity. So this is a sample of the form, and it's just a sample. I really recommend tailoring it to what you're seeing with your patients. So there's a bunch of different options. And I like this form, especially because it allows you to add an additional category. So you aren't confined to what's already available on the form. Something that is notable within the transgender community, especially, is that we have a lot of different words to describe ourselves. And so that can shift through culture, but that can also just shift through like evolution of thought and discussion and conversation. And as we experience more like openness around being able to be trans and existing, that language may change. So it's important to be mindful of that and to just have something that allows people to write in a category that a service provider may or may not think of. And so the second part of that question is, what was the sex you're assigned at birth? And that's pretty simple. So male, female, or intersex. And I want to make sure that we don't confuse being intersex with gender identity. It goes back to what Thaddeus was saying about hand and lap. So we're talking about the lap right now when we're talking about sex assigned at birth. And yeah, so that's what that form would look like. And then this is about pronouns. So you'll note that even on my screen, I have my pronouns, they, them. People typically use, or in the binary sense, people typically use she or he, but not everyone uses those pronouns. It may not accurately reflect their gender identity. So they, them are popular pronouns for people who are non-binary or choose just to, as an act of solidarity, not to use solely she or he pronouns. Some people can use she and they, and you can interchange them. And then again, this sample form has other please specify, which I want to highlight again, is a really great way to respect identities that we may not think of or that may be new and evolving. And then the recommendation on this too is that to use the language of the people that you're seeing. So if someone's saying that they're mahu, then that's how you want to address them or talk to them. If they're saying that their pronouns are they, them, then you just roll with it. It's not really, it doesn't hurt us to honor someone's pronouns, but it can be harmful to them. And that's what the data shows. And it's just such an easy way for us to affirm, especially youth, and to like reduce all the harms that Thaddeus highlighted, because it really does play out that way. And then so within the SGM work group, I'm the policy lead. And so what we do in the policy, it's a subgroup to the committee, to the work group, and we try to come up with different policy ideas that we think will further the progress that we've made. I mean, Hawaii is really doing very well with its anti-discrimination policies, but we could, like I said, we can always take it a step further. So before the legislative session got cut short due to the pandemic, we actually drafted our own resolution, and the resolution was HCR 145, and basically it would have committed the Department of DOE, the Department of Education, and DOH, the Department of Health, to making sure that the data they collect for BIRFIS and YERBIS are gender expansive and SOGI inclusive, so sexual orientation and gender identity inclusive. And it also would have required like regular reporting this is especially important for DOE because it would have given us a lot of the great data that we actually have from the two reports that the two SGM reports that Thaddeus was talking about. Another really great bill that we were tracking and supporting and was really moving along was the LGBTQ plus commission. So if you're familiar with the Women's Commission in Hawaii, they advocate for women's issues specifically, but this commission would be similar, but it would be for LGBTQ plus people. And we were really, really excited about this bill because it would have just allowed a lot of more progress to have been made, because it would have been a commission dedicated solely to us. And unfortunately, it died because of session. But we're in conversation, and the bill will be brought back in 2021. And with that said, we invite ideas, if you have any that you've noticed in your service providing for legislation or any policies that you may think of that could really benefit SGM youth in particular. That's all I have.
Thank you so much, Jen, and thank you, Thaddeus. I am inserting a lot of resources for you in the chat box, and I'm going to share our second polling question. You should have the poll number 2 showing up on your screen right now. And then we're going to transition to a moderated discussion between Jen, Thaddeus, and myself. Feel free, there's 2 little talk bubbles at the bottom of your webinar toolbar that says Q&A. Feel free to insert any questions into the Q&A, and we'll be able to answer any questions you have. So far, I don't see any, so we open this up for everyone now to think about the information that was shared. There's a lot of great information on the data and resiliency and protective factors, and then actions that are being taken by the Department of Health, other agencies and advocates to continue this work forward. So in our discussion moving forward, I wanted to open it up to Jen and Thaddeus of how can AlohaCare be more mindful and responsive to the data we collect, and how data are used to create appropriate programs and services?
Okay, so thanks, Jen. So great question, Aloha. And I think just to start simply, and Jen presented it really well, is just adding another question is a huge step. And I know working in a large government bureaucracy that adding a question sometimes is a simple step, but not an easy one. So I think just making that initial step forward really indicates that your organization, but also I think to the community, that you folks are trying. So if I were to come and I were to be asked, what is your current gender identity and what is your sex at birth? I would be stunned, and I would be so appreciative, and I think I would feel so seen, and I would be more willing to participate in care, just knowing that you asked a simple additional question. And even if it's not added, I think formally yet, just if you're, as a provider, if you ask that question, or you ask, what can I call you by, what pronouns do you go by, I think that makes a world of difference for so many folks. Jen, do you want to add anything to that?
Sure, I can just attest to that from my own life experience. Like, I'll never forget the first time I was asked my pronouns. And then just even going to, this is with Kaiser specifically, just like anything, forms that are anything that's affirming in conversation, just using my pronouns correctly. And also never forget the first time I saw a form that had a gender neutral space for me. And you just don't get to see that all the time. And I think it's worth it, even if you are in a bureaucracy.
And how do you think AlohaCare can connect our work to the context of policymaking that does or does not distribute resources for disparate populations, and looking at the spectrum of disparate populations that Hawaii is collecting data on and is able to disaggregate?
Well, for me as a policy lead for the SGM group, can you submit testimony, please? It really helps. It really helps, especially to have providers who are there on the ground with our community, So submitting testimony is great, engaging in conversations with your own family and friends, and just kind of breaking down what that looks like from a provider's point of view, I think is really helpful.
And I see one of our managers here has submitted a comment that the state Quest enrollment form doesn't afford that non-binary X yet, but I want to share with everyone that that is work that Jen and Thaddeus, the Department of Health, are working on. So stay tuned. And this is an opportunity for actually AlohaCare to be a leader in this industry and to not wait for DHS to tell us what to do, but for us to make sure that we're being proactive to meet those needs before we're even asked to do so. And so thank you, Kelly, for bringing that up. I wanted to take a look at our Q&A box. It looks like we have some coming in. The first one, you mentioned that culturally and historically Pacific Islander communities were accepting of trans individuals acknowledged more than two genders. Can you talk a little bit more about why that has changed?
I can speak to it a little bit. Thaddeus can too. I guess Western colonization is basically what it comes down to. Western thought is that there's only male and female, and that it's actually a tool of oppression, to be quite frank. Because what it does is it says you don't exist, and we don't and therefore we can treat you in a certain way. And that's just kind of how it's been. And it's only been, thanks to so many trans leaders here, especially in Hawaii, who've really put their feet on the ground and gotten to push these laws through way before we worked on X marker. There's a sense, there was a lot of erasure, but we're pushing back, and it's for our own health and lives.
I'll just echo what Jen said. Because when we spoke with Ka'amahu, the folks that we had mentioned, it's really a matter of culture, kind of like what Jen was saying. So they were noting that the resurgence of empowerment of our local Ahuehine Mahukane really came back with the Hawaiian Renaissance. So it's inextricable from cultural awareness and cultural practice, and really, lifting up the voices of our folks who were formerly kind of pushed to the side. So.
And in doing research and my due diligence to set up for the panel today, I wanted to actually offer and share a traditional saying that's been known in Hawaii many generations ago. So, he ma'i ola ole kahuna. So basically this saying means that no doctor can change someone's gender without their informed consent. And I think it's really important in Native Hawaiian culture and society that it's also important to note that our language doesn't have gendered pronouns. So as somebody who grew up speaking Hawaiian at home with my tutu, I actually learned gender pronouns later in life. And that's actually something I get questioned a lot about now, because when I speak in English without gender assignment in the pronouns, I often get questioned of, who are you talking about? Or wait, can you clarify again? And I realize that that's a part of the family values that have been passed down to me in my family that don't always resonate in the formal environments that we maybe work in. So there's another question here. Do state agencies have plans to integrate SGM best practices and knowledge into health programs, especially efforts to address the COVID pandemic?
I can speak a little to that. So since I'm in the health department, of course, I'm getting slowly roped into the COVID response, especially since I work with a lot of our communities. So what we're trying to do is, like we just mentioned, is actually integrate SGM questions into just COVID contact tracing. So that's something that I'm working on right now. There's lots of opportunities, but also lots of challenges, as folks can imagine. So just know that there's folks in the inside trying to do what we can, but the more that you folks can show support in the communities or AlohaCare as an organization, the more we have that kind of backing to push for it internally. So great question. Thank you.
And I just wanted to kind of add to what you were saying too, Kealoha. In the SGM report, we noted that when we were talking about the X-marker bill with the legislators, we highlighted that it was Native Hawaiian youth and Filipino youth who were the highest percentage of trans identifying people. So like culturally speaking, that was something I wanted to mention.
Thank you, and that might lead to the next question. Are you folks able to share with our team about other healthcare experiences where people have experienced a negative or a difficult way of interacting with the healthcare environment? Or conversely, if you're able to share some positive success stories where people are interacting positively and resiliently with the healthcare environment?
So for me, a lot of it is just like my own lived experience, and then like being in conversation with like trans people in the community. But yeah, there are positive experiences, but I think that so what I've seen is every provider is kind of different, and then sometimes it really is just who's behind the desk in that one moment. So I've in places that have been in clinics that have been highlighted as really trans-centered, I've had problems, and then other places where I may not have expected to be treated like the way I need to be for my own mental health. I've been surprised. So I feel like it varies by provider, and it really just goes back to just recognizing the person before you. And then something that is notable is just like even in like bathrooms, just making it gender neutral, or just such small things can make a huge difference as far as what providers are doing.
Yeah, and just to add to what Jen was just saying, I think it's healthcare team, but at all levels of healthcare contact, I guess. So it's not only the provider, but it is like the receptionist at the front desk. I mean, that's the first person that someone encounters. So we hear folks who will not go to a clinic because the front desk person is so rude to them, even if the rest of the staff is awesome. So that first engagement point was really important for a lot of folks. But when are supported, it's like wildfires in the community, like coconut wireless. So everyone's like, go here, they're the best. And conversely, they might say, don't go here, they're really not the best. So.
Oh, we lost you at the end there. I think you muted a little too soon there, Thaddeus.
Oh, yeah. We were just saying, basically that people talk in the community and they share their reviews, not by Yelp.
Absolutely. And though I'm not in clinical practice anymore, and I'm not seeing patients right now, when I was, one of the things that was really helpful for me as a clinician was working with the families, working with including the receptionists, but also working with the schools. I primarily had a patient panel that was largely youth and adolescents, which does match a lot of our makeup on AlohaCare's membership demographics. And just being able to ask the youth and adolescents of what their preference is, rather than asking what their parents' preference for them is. I found that actually to go a really long way with the therapeutic rapport and environment, that they understood as my patient that I think there was a bit of that trust building where they understood that I was on their team, and that I was actively listening to what they were saying was a part of their needs and why they were there, truly to want to get healthy and to experience health in a different way. And so I think that those are great ways that folks that work in PCMHs and these patient-centered integrated, medical home groups, where you have lots of providers working together, can really share in that knowledge and uplift best practices and emerging trends together. We have another question here of, are you folks able to provide specific, here it's listed as therapist, I might broaden that out to providers who are actively and open to care for members of the LGBTQ range?
I don't have a list or anything. I mean, I have my therapist, but I'm not going to say his name.
Yeah, and I know that some of our folks in our work group are trying to compile a list of safe providers, but as you can imagine, it's few and far between right now from what they can ascertain, but they're trying. So if as soon as that's available, we'll definitely post it on our website and share with folks.
Maybe as a follow-up question to that, in addition to individual providers, are there emerging clinics and programs that you folks wanted to share with our team so that they're able to look more into those services? And we might actually already be working with some of them. And that's a leading question because I know we actually are working with some of them. And one of them is actually a part of our board.
Well, I already see Kelly in the chat put Mango Medical and Lavender Clinic, which are two. I would add, any, so on Hawaii Island, because there's just less services on Neighbor Island as well, Hawaii Island is starting its a trans health clinic at Hawaii Island HIV/AIDS Foundation. So that's really exciting. They haven't even advertised, but they're already getting so many clients in through the community. And then Malama Ikeola has Transcend Clinic on Maui that I would highlight. I don't know if other ones you have to add, Jen?
I think you really covered it, and thanks so much for highlighting the neighbor islands. The Trans Care Clinic at Kaiser is a go-to from a lot of folks on here.
Yes, and somebody entered into the chat that leading question that I had volleyed to Jen and Thaddeus. Yes, Malama Ikeola on Maui is also doing some great efforts with their trans clinic and programs, as I understand. Is that right, Jen and Thaddeus too?
Yeah, I think that's their Transcend Clinic. They're super cool.
Two more questions as we wrap it up. Looking here in the chat box, if someone is changing their pronouns often, say one day they are identifying as male, the next female, and the other day is they, them, what are ways in which our team can be responsive to those changes?
I do my best, or I recommend, this is a recommendation, that just honoring who the person says they are, and just being flexibility, I think, is really important because, I mean, if someone's using different pronouns, it might just, we don't know what they're what's going on with them. So it could just be that those are the pronouns that they feel comfortable with that day. And so we want to just make sure that we're honoring those pronouns. And it's really I think that simple, just being flexible and making sure you use what they've told you their pronouns are, and not holding people to it, because it can, people's identities can change and we can evolve as people. And I think we should allow each other that space. Oh, and one more, pronouns don't necessarily mean gender identity. And I want to make that really clear. So just because someone has different pronouns doesn't necessarily even mean that they're trans or non-binary or any other type of gender variation. It just means they have different pronouns. So it's important that's their pronouns. It doesn't really go beyond that.
Thank you for that point of clarification and going back to some of those core terms and definitions that Thaddeus had shared at the beginning. Thaddeus, anything else you wanted to share? I have one more question here before we wrap up.
What our clients tell us in a sense is they always say, don't battle the name. So if I introduce myself today, I was like, hi, I'm Thaddeus, but you can call me Ted. Call me Ted. So just don't battle the name. Just accept it and move on, right?
I love that. As somebody with two first names, I battle that constantly because it's really hard to use two first names on everything at all times. It can get actually really taxing for my own identity and my own energy level. So the last question here, and I think this foreshadows a little bit of what's coming up in the future, and hopefully AlohaCare's continued work with the SGM working group with the DOH and both of you in your leadership, is can you tell us a little bit more about how Hawaii's laws are providing extra protection for LGBTQ youth rather than federal law. And Thaddeus, I would love for you to be able to close with the upcoming work around substance abuse treatment and the work that you will be doing with the different branches in DOH looking forward.
So the question was, how are the laws protecting youth? Basically, the law that I wish I could get to the HRS. The law that I was talking about earlier, it was the third one down. Youth should be covered under that because it's a public accommodations law, and that law goes into awesome, thanks Thaddeus, goes into healthcare clinics, insurance providers, and like healthcare clinics too. So anyone that's going to those public spaces is protected under those laws. You may have heard that the Federal Department of Health, HHS, repealed a rule that takes away protections, certain protections, and fortunately, Hawaii has a lot of our state laws should cover most of what was repealed from that rule, and there's a lot of confusion around it. So I'm not going to get really into the nuances, but youth are protected by the public accommodations law in public spaces, which includes healthcare and health clinics. And I think, so that's it. HRS 432D-263. And then if you go to the law itself, there's like a pull down menu, essentially. It's like 1 through 11, and it lists what spaces are protected and gender identity is protected in those spaces. So yeah.
Great, and we'll make that HRS available in the resource list along with this recording and the slideshow that you folks have put together for us. Thaddeus, closing statements on what's ahead for the Department of Health and what some of the work you folks will be doing around behavioral health and substance abuse.
Yeah, thanks, Aloha, and thanks everyone again for welcoming us to your space. So what Aloha is referring to actually is an exciting opportunity that we're working on. So basically the Department of Health over the next 2 years through the Alcohol and Drug Abuse Division is creating a statewide plan on substance treatment for the entire state. And as you can imagine, this includes not only data analysis, but policy recommendations and likely funding allocations to address the gaps in behavioral health and substance treatment. And so as one part of that, we are taking the lead in creating a chapter on sexual and gender minorities and looking at seeing what's needed in Hawaii, what's here, which is unfortunately not that much, and what we would recommend. So in the next 2 years, there's going to be a lot of work to identify the gaps and see what we can recommend. And I'll also add, this does not only affect our SGM communities, but our houseless communities, our Native Hawaiian communities, and all the intersections that come in between.
Great, thank you so much. We're just so grateful to both of you. Not only were you able to provide these great tools and resources for us, but you really brought the intersectionality of the social determinants of health and culture and values in Hawaii to the forefront as we talk about housing and poverty and the need for food and what responsive education systems look like. So as we wrap up today's webinar, I really want to mahalo you, Jen and Thaddeus, and the Hawaiʻi Department of Health's SGM Working Group for your time, your expertise, and your generous sharing. I want to thank AlohaCare's leadership team for supporting this new initiative. And I want to mahalo all of you for starting your day with us to enliven a culture of health across our organization. We have some next steps for our work ahead. Like I said, we're going to load this information and we're going to share it. We're going to provide information in our provider and our member newsletters, and we'll be working on some data analysis for the SGM provider claims and codes, updating our data systems and fields, and working to create an AlohaCare sexual and gender identity policy. So I especially want to thank Mallory, Brennan, Bianca, Tomer. We have a small but mighty team growing behind the scenes. Should you have any questions or ideas on how we can follow up, better develop this work, and share how that might help your department, please feel free to email me. Please stay safe, everyone. Have a good rest of your day. Mahalo nui ʻoukou for joining us this morning. Aloha.